Hi, and welcome to another video from the CTAD Clinic. My name's Dr. Mike Lloyd and I'm the Clinic Director. And this is the part 2 of a mini-series looking at comorbid conditions associated with the diagnosis of dissociation and how confusing it can be for clinicians to be able to understand what alters switching in and out or influencing from behind can actually mean. And in this video, we're going to be looking at other specified dissociative disorders, OSDD. In the first video, we looked at dissociative identity disorder, DID. And this is going to be on exactly the same lines, but understanding how the influence from behind, i.e. what's seen in OSDD, which is alters much more in the periphery and in the background of the person, but can exert a great deal of influence on the life, emotions and behavior of an individual. So we're going to be looking at OSDD in this video in exactly the same way, and they're going to tie it up at the end with some conclusions on what this might all mean. Other specified dissociative disorder, which is more about the internal influence, which is there isn't really that outward manifestation of a change of behavior, but there's a lot of change, a lot of fluctuation that takes place on the inside. And how this presents itself is often sort of a chaotic load of voices taking place, arguments, emotions arriving and appearing very suddenly, seemingly out of nowhere, or triggered by seemingly inconsequential events as a result of prior trauma. We have then the person with the system is hugely distracted, is that there are loads and loads of different things taking place. It can be quite chaotic, it can be quite manic, it can be quite intense, hypercritical, often very judgmental, a lot of the times very unpleasant, and sometimes with flashbacks and memories being thrown in. So if we look at that as a fairly common manifestation of OSDD, where people are losing track of the present because they are focused on this internal world, we'll look at and see what criteria might be triggered in the other two conditions. So one of these within the borderline personality disorder is this explosive anger, is that seemingly a person can be going in one direction with one set of emotions, and then very similarly something happens and they become very angry, and it's almost like an explosive quality. Often happens if that person is being denied access to something, or there's a perception that they're not getting their needs met, and the anger, the unregulated anger can come out in a huge way. That can simply be a complex traumatic trigger that sets off an internal action system of rage and anger, and the internal part influence of anger suddenly manifests itself and fills that person up. Can be the opposite, and it could be a complete shift and move away. The person could be connected to what's happening in the world, and then suddenly everything is absent and everything's gone, and the person's in more of a numb state, in more of a sort of depressed internal state, where everything starts closing down and being boxed up and compartmentalized, and all the emotions are being removed, and there's an emptiness that exists. And that's the second criteria for borderline personality disorder, which is a chronic feeling of emptiness. So depending on whether the manifestation is like a hyper set of emotions that are coming in, like loads of anxiety, loads of fear, loads of rage, loads of stress, or a hypo, which is a numbness, a depressiveness, an absence of things, both of those can trigger those sort of criteria for the borderline personality. At the same time, some of the consequences of this internal chaos taking place is that the person becomes extremely distracted. They're not able to focus on what's been going on. They may lose hours and hours and hours away from the task in hand as a result of this. And we know from clinical examples and people telling us that they can lose hours and days of their lives stuck listening and being mired in this internal world that's chaotic, that could be raging, or it could be so silent and scary that the person doesn't really feel connected to the world at all. So being distracted easily is part of the diagnostic criteria for bipolar, and we absolutely understand when we're talking to people with OSDD, when they're focused on the inside, that they are completely distracted from what's taking place in the here and now, and that can take place for quite a long time. And the second bit of bipolar is this thing about having racing thoughts, which really describes itself when most people are talking about their OSDD. There's this sort of conversation, these multiple dialogues taking place inside the system, and a person really gets stuck listening to all of this stuff going on, and the difference between a thought and a voice get quite confused, and the person loses track of where they are and who they're listening to and who they even are. So the sense of self can be affected. So within the bipolar diagnostic criteria, we can see this distracted easily and racing thoughts are very, very commonly experienced with people with OSDD. And while some of the manifestations of both the borderline and the bipolar are sort of extensions of normal behavior, because lots of people are impulsive, lots of people do things for lots of different reasons, get distracted and all those things, both those conditions require these to take place over a significant period of time and to last for quite a long time. So we're not talking about like minutes here, minutes there, and it happens every now and then. These are lifelong chronic experiences that people are experiencing. Within that, then we're looking at the symptoms lasting for days, maybe taking place over years of a person's life, and maybe going all the way back to childhood, adolescence, and emerging adulthood. Now, the criteria for those for borderline and bipolar are that they are taking place for a long time, they are qualitatively different from normal experience, there's not often a particular reason why that might be happening, and the duration can be quite a long time. All of this we see with OSDD and DID because these are manifestations, these are symptoms that take place from early childhood into adolescence and early adulthood. They can last for hours, weeks, months at a time, and they have a really negative effect on the individual, and therefore would also trigger the diagnostic criteria of borderline and bipolar. Both of those conditions then could be considered to be present within individuals with OSDD and DID, especially when the OSDD and DID is not known about. So many individuals spend a long time before they arrive at the awareness of the internal system. They simply sit with all of these symptoms taking place for many, many years, and as they describe them and as they get presented to clinicians in the real world, often the wrong diagnoses are given to those people. Now, again, as I said, they could be comorbid, so they could be conditions that are existing at the same time. So both borderline and DID, both bipolar and OSDD, absolutely that can happen. But what we see often is that those psychiatric level diagnoses often arrive first, and it's only later on in life that the OSDD and DID starts coming to the fore when the more detailed questions about dissociation are being asked. And this is the primary problem, is that the symptoms can manifest themselves across a multitude of different diagnostic categories, and the only way to know for sure is to have the language of dissociation built in. So when a clinician is trying to think about borderline or trying to think about bipolar disorder, for example, if they start introducing the language of dissociation, the person's either going to say, yep, that is my experience, or no, it is not my experience. And if it is their experience and that dissociative language, the style of questioning that we have for dissociation is apparent, then we got to move away from those other diagnostic criteria and sit with the OSDD, DID type stuff, because that's the more likely cause, especially within the context of the trauma history. It just gives us a different way of being able to assess the same symptoms criteria, narrow it down, and hopefully make the right decision as early as possible for that person so that they can be moved on to the correct treatment pathway. Because as I've said in the previous videos, if you are misdiagnosed, even with the best will in the world, if you're misdiagnosed with something like borderline or bipolar, the treatment pathway that you're on won't have dissociation taken into account, because if it had done, they might not have been diagnosed in the first place, and therefore the treatment, as the research shows us, is less likely to be as effective as it should be, and that person then just wanders through these treatment pathways for potentially years on end, really not getting any better, and it's a bit of a waste of time and resources for everybody concerned. So getting this criteria right is vitally important, and that's what this series is trying to be about. It's not validating the presence of one condition or another, it's simply saying that if we are going to diagnose, we have to take as much information into account and introduce the language of dissociation as much as possible to either rule it out completely or have it right there, dead center, so that we know that that might actually be the answer that we've been needing all along. Hopefully this has been helpful. There are more diagnostic criteria to look at. I've only used those two as an example because those are the two big psychiatric ones that we've already covered in this series so far, and I thought it'd be useful just to show some examples of what happens if alters switch in or are influencing from behind the scenes, and how confusing that can get for clinicians who don't really understand what dissociation is all about, and hopefully they improve that as they go along. So please leave any comments and do all the usual, like, subscribing, sharing of the video. Really pleased that people are doing that. Really pleased that this series has been successful, and I'll keep adding to it. Got some really nice stuff coming up, so keep a lookout on the channel for what's happening next. And in between now and then, obviously, as always, please do take great care.